We want to know the scope of drug resistance. We want to know what causes drug resistance, the causes of it, all the things we do that can bring about resistance. We want to know the consequences of drug resistance, and we want to know how we can cope, how we can manage, all the things we can do to correct all that. But before we do all that, our dear viewers would like to know briefly what drug resistance is in a layman's language, because you understand that not all of us will understand at the same pace. So Alfred, how can you briefly, we don't want those scientific words, you know? There is someone telling you a definition and you need to first go to Google to see what he was meaning.
Now the funny thing is, what we're talking here is science. But our job here and our role is to make sure that our viewers understand everything in the simplest way.
Yeah.
So I want you to imagine a situation. You have your lock at home. So this lock has a key. And then every time you come back from work, you insert your key and then the lock opens. One evening you come back from work, you try to insert the key into your lock and the key doesn't work.
The same key that used to
Yes,
work.
the same key that has been working always, it's now not working. So the same thing happens. You see these microorganisms that cause diseases, the likes of bacteria, parasites, fungi, viruses, all those ones. They have cells, they have a body structure. So these organisms, whenever we are formulating drugs, these drugs are formulated in such a way that they can target sites in the bodies of these microorganisms. So those sites, the microorganisms also develop a way of changing their structures so that when a drug comes in, it will not fit. Let's say it's an enzyme. Remember, an enzyme works in a lock and key mechanism. So the enzyme will change its appearance or its shape.
These microorganisms are trying by all means to protect themselves.
Imagine it was you. You have someone who is always disturbing. What would you do? Definitely you have to run away. Yes, you have to look for a solution. If this person, thank you. So this is the same thing that these microorganisms are doing, and that's what we call drug resistance.
And we actually see that in our daily life a lot. It's actually a silent pandemic. It's eating us all, but we are not realizing what it's doing, because it's where all other drugs rotate. Because when you take a drug, it is expected to work. Now what if it doesn't? Which means this is driving all the drugs. Fred, do you have anything to talk about?
Maybe
give us an experience.
I can define drug resistance as, this is where microorganisms, they change. As we said from the start, that we are here to make things simple. So I don't want to go into details that I should tell them to change. But what I can say is the microorganism change. I give an example. Maybe you used to take a amoxicillin for cough, but if you take it anymore, this microorganism can either be a bacteria or a fungi. They don't respond to this medication anymore. So they change and they don't respond to that that medication anymore. So in simple terms, the microorganism changes, then they are not responding to the medication.
So that means that, is it the reason we are seeing many brands of drugs at pharmacies?
Exactly.
You see this, but they are modifying the same drug in a certain way.
You find different generations of drug. You find that this generation was better working on maybe to treat certain condition, but now we see different generations are coming to the market. You find fourth generation, it is the one that is working now.
And even aside from generations, people have even tried to develop combinations. Let us combine this with this, we bring about synergism,
to amplify the effects,
potentiation. And according to WHO, by the way, even these combinations are failing. They are also failing, because WHO notes that at least 1 in 6 infections.
Which means we are fighting someone who is also strong.
These are living things. They also have to strive and survive. That's why they are living for generations. You find bacteria has been here and it's here to stay. And better, we need it as well. However much it causes disease, it is part of us.
I think now the concept of natural selection is applying to almost all organisms.
For as long as
it is survival of the fittest.
Yes.
So the organisms are also trying to develop, all possible ways of
for them to survive,
extending their generation, extending their lineage. They are trying to
remember, for them they survive on you.
Ways.
They survive on you. They eat on you, they get all their nourishment from you, and now for you also trying to fight against them. You don't want to live with them. Yes. So as someone is trying to attack your job, you're also going to attack back. You have to find out protecting your job, because tomorrow you won't survive.
Do you see why there is a need of pharmacists who always develop drugs, who always modify when they see that maybe this microorganism is doing this. Maybe it is pumping out the drug that we are giving, which means they have to bring a drug that will have to escape that to make sure that the microorganism will be killed in actual sense.
True.
That is the importance of making research all the time. That's why we go back to school and study, do this and the other, so that we always come up with solutions. Because as we are also trying to come up with new ideas, the microorganism is also trying to come up with new ideas of survival. It will not accept.
So our dear viewers, I think that you're now getting what exactly we are going to talk about. We are just in the introduction, but people already have content to deliver. People are already giving what we've not even reached at. They are giving us the causes, which means they are well packed with content. So we'd like to officially start. We want to know, because for me, I can understand that these causes, you can find that some are behavioral, that we are the main cause of the causes, and you find that some are genetic, some are scientific, many causes of this. So what do you think are the causes of this drug resistance? Because I don't think it's just the work of us. You can find that now, like you've talked, that some microorganisms will have to pump out the drugs, which means we are not just not doing our work, but even the microorganisms are trying to put things that are going to make the drugs be resisted. What do you think are the causes of this resistance?
Now, there is a concept of patient's compliance whenever we go to the hospital. Let me just try to start from there. Imagine you went to the hospital, they have diagnosed, they have run all the tests, CBC, all kinds of tests, and then they realize maybe you have streptococcal that is disturbing you. Now, this bacteria has to be given antibiotics for it to be chased out of your body. But the prescriber or the clinician writes for you medicine. You go and take amoxiclav, maybe 1 gram or 625 milligrams twice a day. Now, among all the formulations they have given you, there is a capsule. Now, our people have this tendency of saying that that thing, the encapsulator that you see on the capsule, that gelatin, for them they know it's a gelatin. For them they think this thing causes what? Cancer. And they have that tendency of putting it in water, and when you put it in water, it is going to swell.
And who gives you a drug that is going to cause cancer?
And now that is how funny it is. That's what patients believe. So someone comes, you give the medicine, you tell the person, swallow the medicine as it is. Then they are going to tell you, me what I want is the powder inside the what? The capsule, because it's what is going to work. But this thing that is covering the medicine has nothing to do with my well-being. So what these patients do, they are going to put off that cover. But forgetting one thing, this cover is not a design. It is a formulation for a reason. Pharmacists design this thing that way, either to protect the medicine from the acid in the stomach so that it can be delivered to the intestines, where absorption can take place. Or the medicine inside the capsule is maybe highly acidic.
And I'm even told that there are some drugs that cause ulcers.
Yes. So the drug is put in that capsule to avoid causing those ulcers on your throat as it is passing. But patients do not care to know about that. So you find that the medicine is going to be taken by the patient. He's taking only a powder, and then this powder is going to be destroyed in the stomach by the HCl. And then you find that the medicine will not work.
There is this lady I talked with last time, and the lady was telling me this drug flu cap.
Yes.
The lady was telling me that when you remove this cap, these drugs work so well. And the lady actually convinced me, and I was like, hey, how would they form it like this? And they will just have to tell you to remove the powder, leaving the other one.
Now, the funny bit of it all is that everything has an advantage and a disadvantage. Removing the cap does not always necessarily mean that the medicine will not work.
Yeah.
For some drugs, because some drugs are going to be they are going to reach the stomach, then there is some liquids in the stomach, then it becomes a solution and it is easily absorbed from the stomach, and then it will work very fast. So it is very difficult for you to convince a person who has got an experience like that this medicine you're supposed to take with what? With a capsule. Because she's telling you, when I remove, it works faster. Again, you want to tell her, you leave the capsule, just swallow the medicine. So that is one of the causes of drug resistance, patient's compliance. Instructions are different, the patient is taking a different way.
Thank you so much. I would also love to comment on that point.
Yes.
There is a vice that is eating up the medical field. It's called self-medication.
Self-medication.
That is very dangerous. Very dangerous.
Self-medication, I think it's, now with the technology we have nowadays, everyone now believes that they can treat themselves.
Yes.
Information
I'm not saying it's bad or it's good, but it's something that is destroying us. I can give you an example. Nowadays, someone gets flu and he goes to the hospital asking for amoxicillin, forgetting that flu is a viral infection.
Yes.
And if you treat flu with the amoxicillin,
Antibiotics.
in simple terms, you're giving this microbial organs to
the normal flora in your body
to
your
go,
sensitizing them, there is
to
something
come
that
up,
can destroy you.
Then they will develop different mechanisms of resistance.
Yes.
Which is, self-medication is not bad, but you should do it under the guidance of a medical personnel.
It is bad. Let us not try to.
You're telling people the truth.
It is bad. Yes, that is a fact. You see, sometimes we may try to cover up the fact, and because you don't want someone to feel offended.
But under the guidance, okay, why I'm emphasizing, but at least you should be under the guidance of a medical personnel.
Then that is not
qualified.
So it ceases to be self-medication.
Personnel. Hey.
Yes,
but it's really one of the vices that is really eating up the medical field.
Me, I'm telling you, patients
and it is causing
come, and then they'll tell you, give me this, give me this, give me this.
As I told you, that incident of people treating flu with amoxicillin, people should stop.
Which means someone got that from Google. That when you have this, you're supposed to take this.
Even
and that's
from
what
friends.
they're asking for.
Even from friends. You tell your friend, man, I'm having fluitis. This time he mistaking. Oh, last time I took azithro and it worked for me. Just go and buy. You see, what we forget is that sometimes these conditions are self-limiting. Now, flu is a self-limiting condition.
Yeah.
Even when you don't take medicine, it will go away. So someone will take the azithro. In the long run, the flu will go away. And they will think the azithro has one that has worked on the flu. The fact is, it is just the immunity that has fought against flu and it has gone.
So most of these self-limiting conditions, maybe the advice to our viewers, you just need to boost your immunity.
Yes.
You eat food rich in...
Take supplements.
Yes, rich in vitamin C. Something that is going to boost your immunity. Not that everything, whenever you become sick, you run for medication.
Yeah.
No.
Which means we are all talking about, because there is this concept of irrational drug use, using drugs in a way that is not right. They are telling you to take 2 times a day, and you find someone taking once a day.
Now,
and they want to repeat tomorrow.
Sometimes it is funny. You see, you go to a pharmacy, someone is prescribing for you drugs, they write for you paracetamol, Panadol, 2 tablets, 3 times. You see, some of us are mathematicians.
Hey.
Now, for me, what I will do, I'll just know 2 times 3 is 6.
Aye.
So instead of burdening myself with taking, now, like right now, we are fasting. So I can't be taking drugs after every 8 hours. So instead of me taking the medicine after every 8 hours, what I'll do, I'll just multiply 6. That is in every 24 hours. I take the 6 tablets once, forgetting that there is what we call a therapeutic window.
Yeah,
and
that
then
is so bad.
So I may exceed the therapeutic window and end up getting toxic effects, completely toxic effects.
And we see that there is no way you're going to.
And by the way, paracetamol is very dangerous. Okay, Panadol.
Someone starts sweating from nowhere.
Especially to your liver.
Panadol,
very dangerous. Very dangerous.
Long run to your liver.
But he
talked about that, the numbers. but 2 times 3. There's
Hey,
something
but
so
are there
interesting.
people who can do that?
Yeah, it's funny.
You're joking. A
Sometimes
patient
we
asking
assume,
me. A patient
we
asking
assume that
me.
people know these things.
If
but
I
not
take,
everyone
you've
is
written 2
doing.
times 2, if I take 4 once, is it okay? That was the patient asking. So for you, as you're assuming, there is no one who can do that. Don't joke with every. Okay, don't joke with patients. Don't joke with our
Okay.
patients.
These things are possible.
It is very serious, actually. Very
You know,
serious.
That is why we really need to intensify this awareness shows that we are trying to come up with, because some people don't know these things.
There is this concept of us going to hospitals for diagnosis, and maybe the doctor says that according to the maybe bacterial load, viral load she's supposed to take this amount of that drug. After maybe they are telling you to take twice a day, they know that after 12 hours you're going to take a certain dose, which means when it's getting done, you're loading on another dose. But you find someone, they are taking once a day. And now you're sensitizing the bacteria, you're sensitizing the virus. They are looking for ways to run away from that drug, which means the moment you overmiss these drugs, the microorganisms are going to develop resistance.
True.
Yeah, in actual sense.
That one also runs back to compliance. Like I told you,
Yeah.
compliance is very key
So
in
we are
management.
blaming all this to patients.
Now, okay, let us first of all leave the patient side alone. Now, there is this also tendency of privatization of healthcare services delivery. We have a lot of private facilities running, and these private facilities are renting the premises where they are running their business. These private facilities have workers who need to be paid. There is URA, which needs taxes from you. Like, there is a lot of load on your company as a healthcare service provider. Now, you find yourself, you have to make sales. Because the only way you can kick out all these the only way you can kick out all
just go to buy to pharmacies.
the only way you can kick out all the expenses on your company is by making sales. So people are even giving daily targets that if you don't make this amount of money, you're not working. If you don't do this, so here comes a patient who is having flu. And I know, okay, flu and cough. I know if I give a symptomatic treatment to this patient, the flu will go away. Maybe I just need to give an antihistamine to reduce on the flow of flu. Then I just need to give maybe an analgesic to reduce on the pain they are feeling and maybe the fever. Then I just need to give one antibiotic to cure the what? The cough. Or if the cough is productive or dry cough, I need to just top up maybe a cough suppressant or an expectorant. But then you find I'm going to give this patient a cough suppressant, I give an antibiotic, I give almost 3 antibiotics because one is 8,000, another one is 15, and when I give all those drugs, I may end up taking maybe 60,000 from this patient.
Which means also dispensers can be a problem.
Yes, and that is what we call polypharmacy. Sometimes it is practiced on what? It is practiced on a intentional basis. Sometimes it is because you're not aware.
But the moment you do that, you're not helping me. Because
of course, the patient is going to get better. The patient will get better. All these drugs are going to work. But in the long run, you may find that the patient, if you give one antibiotic like this, it will not work.
And we want to hear from Fred some of the consequences, both short-term and long-term consequences of drug resistance.
Once again, thank you for the opportunity. Recently, when I was making research about drug resistance, I came across a study by World Health Organization. They say that per annum, 1 million deaths is recorded. Then globally, they record around 5 million deaths. So you can really see how drug resistance is such a crisis within our society. Very many people are dying. Actually, they say even the death are a bit higher than even the common diseases we always hear, HIV, diabetes, cancer. So you can really see how the problem of drug resistance is such a crisis within our society. There's also a study they say that they are projecting from now up to 2050, they expect that we shall lose around 39 million people. So drug resistance is such a vice that is spreading at such a higher rate. So one of the consequences our dear viewers, is death.
Yes.
You will die. These drugs here, you know, if these organisms resist the drug you're taking, they will take you. So death is one of it. Then
Which means if you do not realize that it is the resistance is because of actually the microorganism itself resisting the drug, you might end up dying. But if at all you can consult a doctor to know the cause of that resistance, they can maybe find a way to help you.
They offer you better alternatives.
Oh.
We also see other causes. Other causes, we see them coming up, whereby we see people going to the hospital. You know what comes when you go to the hospital? It comes with costs. You end up even spending more money when you're in the hospital. Remember, there will be prolonged hospitalization, and the longer you stay in the hospital, you know what comes with it. You are going to spend more money also.
Sometimes it depends on when you went to the hospital, because sometimes you see people going to pharmacies. You just walk into a pharmacy, you have an infection, and you're just purchasing a drug. You've not gone for diagnosis to know the actual thing. And now, because the drugs have failed to work, now you're going to a hospital for diagnosis. Now, to go through the right process, you pay the consultation fee, you pay the lab tests, and then you have to pay for the drugs, which means all those costs can be also due to your maybe laziness, or maybe you don't know the reason as why you should first go to the doctor before you buy the drugs.
Then the number one is actually the song we have been singing the whole. It will be treatment failure. The drug will not work. Treatment failure is one of the consequences. But all I want us to know, we have really entered into a post-drug resistance era. So we really need to take be conscious and take the initiative that this drug-resistant thing is serious.
Yes. So, Alfred, what do you have to say about the consequences? Because we want to finalize with this thing after talking about what we should do to overcome that problem.
Now, let me first of all emphasize on this last point, therapeutic failure, treatment failure. I am just imagining the burden and the psychological torture someone is going to experience. Imagine you're bedridden in the hospital. The doctors have tried to do their level best. They have diagnosed everything. They have done everything the right way, but you have no change in your situation. It is as if you have a cancer that is eating you up. And just like our friend here quoted that globally it is projected that death may surpass 39 million. That is almost going beyond the annual death toll caused by cancer almost every year. So just imagine such a disease like cancer, which is too lethal and too dangerous, being surpassed by a simple condition, which is just drug resistance. You're dying of malaria, but just because the antimicrobials have failed to work. You're dying of a cough, mere cough, just because the antibiotics have failed to work. So it is really disturbing. Psychologically, it tortures not only you, the person who has died, but even your relatives and family. Just imagine you've been the breadwinner of the family, and then at the end of the day, you're gone just because of drug resistance. What is going to happen to these kids that you're leaving behind? Who is going to look for their tuition? Who is going to feed them? Who is going to foot all their health expenses? You end up even burdening, you're shifting your financial burden from your own self, even to relatives. Now you become a burden. Whenever they see your kid somewhere, even relatives want to take off. They know this one is coming with a problem. Whenever you call someone, they will not even want to pick up your call, just because of drug resistance. So basically, all those consequences can be avoided. And I think that is what we should be aiming at right now. We should aim on how are we going to curb this?
So we are going to look at how we can solve all these problems, but we want to know, or we want you to summarize for us, because we've talked about many causes, and from my thinking, I can see that they are the things we do on a daily basis. The causes or what we see, the consequences we have after misusing drugs, they are the things we see every day. So can you please summarize for us before we go into the solution, let us first just summarize for us the consequences, because you've talked about many of them. Just summarize them such that people can highlight the consequences and have them at their fingertips.
Once again, thank you for that. In summary, we shall have long hospitalization.
Yeah.
There shall be treatment failure.
Yes.
There shall be
death.
Higher medical costs.
Death.
Death. We cannot run away from
Long term.
death.
Yeah.
With the time when you overstay in the hospital, then the medication fails to work, treatment failure. Eventually you'll die.
Yes, that's
It's
true.
something that is inevitable in the process now.
And that death affects a lot, not only you, even the country is losing. Now
your
imagine,
your family,
everyone loses, even the country as a whole.
because imagine
you pay
you are now
taxes.
the breadwinner.
Yeah. That
That
makes it worse, because many people are depending on you, and now you're dead because of something you could actually
Avoid.
Yes, before it reached that
Or something with a
extent.
solution, because drug resistance is not HIV, that it is not curable.
Yeah.
Even HIV nowadays, people are surviving.
It's a knowledge problem.
Yes.
And by that, that's why we have such podcasts, such that we can unmask all those things. You might not take them so serious, yet they're the main cause. Now you see that it's also among the causes, the leading causes of death. Yeah, it is competing with cancer, AIDS, which means it is so serious. We are not seeing it in daily life, or we do not realize it, but the statistics say that it is one of the leading, which means we should always seek for knowledge. We should always, and by the way, those who have not yet subscribed, please subscribe such that you're notified whenever we drop a video on YouTube, to keep up with the knowledge. Today we might be talking about this, tomorrow we are talking about another thing, like that. So now what are those things we're supposed to do such that we can overcome that problem of drug resistance?
The biggest challenge we have is not following instructions to the dot.
Yeah.
They give you medication to take for 3 days, to take for a week, but you find someone is taking it for 1 day. They tell you to take medication.
The moment they get some relief and they're done.
3 times a day, you find someone taking 2 times a day.
Yes.
So how we can solve this is you follow the instruction religiously. Follow the instructions in the right way. If they have told you to take the medication 3 days, there's a reason why the medical personnel is telling you to do that. It's telling you to do that to meet a certain concentration of the drug within your blood that is going to completely eliminate all the microorganisms that are going to be within you. So if you don't follow that, you're not going to reach that concentration, and therefore you're not going to completely eliminate the microorganisms.
Remember, Alpha talked about, when we talked about the microorganisms that stay, and now they want to resist that drug, which means they come back strong in action, and that drug cannot work on them again because you've already sensitized them. You've already taken your drugs in half doses, which means they also know what to do when
you've given
take
them the opportunity to develop mechanisms that
so
the
gist of the conversation is that complete the dose. Complete your dose.
It is very important.
Crucial.
It's very important.
Just follow the simple instructions.
Even when you feel okay after taking 1 unit dose, please complete.
Go ahead.
Those drugs are not easy to be taken.
I know.
Yeah, they are not easy, but then you should understand that it is your life. Because,
but I'm already feeling better.
But you should also think about recurrent infections.
Yeah.
Do you want to have the same condition again after 2 days or 3 days? Because
which is serious.
Basically it is a waste of time. You take today, you don't take tomorrow, again after 1 week you're sick again, you have to take, and you're spending money on the same condition.
And remember, someone doesn't go back to the hospital, they already have their drugs, they took maybe half of it and half of it was left.
They are going to misprescribe for themselves.
They have to start from where they had stopped.
Now that brings us to another point of stopping self-medication.
Yes.
I think the core point here should be, first of all, sensitization. Sensitization is something very crucial. It is key. Because you see, some people are making these errors not because they want to, but just because they are unaware of the consequences. They don't know how dangerous this is. Someone may just feel some pain and I'm like, let me take some paracetamol. After all, it is just pain. Because
like those ones who open capsules, they don't
Yes.
actually know the importance of
Actually,
that coat.
because of the misinformation they have, for them they think they are doing the right thing.
Yeah.
They don't know that what they are doing is actually wrong.
Yeah,
And
that's true.
So sensitization is very crucial. People should invest in learning about their health. They should
I
put
think
in more time.
you should allow me again chip in. You know, there is this point of strengthening the regulations. You know, there are nowadays you find people even dispensing drugs that are supposed to be prescribed, which is wrong. You know, if you see most antibiotics, actually, that is, for example, they are supposed to be prescribed before they give you the medications. But we see nowadays someone just comes with money. They
Now
just give you.
you see the
which
problem
is
we have
wrong.
in this country is rules are set, but they are only followed when someone is caught in the wrong. And when we get someone in the wrong is after a consequence has happened. Now imagine you give someone a drug and that person has died, and then the family members of this individual are, let me say, educated, or they are too serious to the point that they want to take you to court. That is when we shall learn that actually I was not supposed to dispense this drug to someone before a prescription. Because there are two types or two classes of drugs. There is what we call prescription only medicines and then over the counter drugs. Now drugs like vitamin C, drugs like magnesium trisilicate, drugs like paracetamol. Now those drugs someone can come, give me Panadol for 500, you give and they disappear. Someone may come, magnesium. It's okay, that is an over the counter drug you give. But now someone comes, this person is hypertensive. Now they are telling you, you see, I have this problem, I have this and this and this. Now you analyze all the signs and symptoms, and your head tells you, it diagnoses this person must be having hypertension, which is actually right. But then you know hypertension is a critical condition. It's not a condition you're just going to give someone drugs. Because you have first of all ascertain, if I give this dose, will it lower the blood pressure? And if it does, will I not have exceeded? Because remember, these drugs that you're giving, they can easily lower the blood pressure to a very low pressure, which can even cause someone to die. But you find someone comes, so I have blood pressure, I need medicine. You pick furosemide, go and take. You pick losartan, go and take. That is not right. So we have, like you said, this issue of regulations. We have to emphasize more on the what? POM drugs. Let the prescription on the drugs be prescription on the drugs. And let those drugs that are over the counter be sold easily.
Which means even the health professionals also have a certain role to play to make sure that this...
It's a collective effort. It's not only the side of the patient, also us, the health medics, we also have to do the right thing.
The problem is that we tend to ignore the ethical bit of it and we look at finances. We are always looking at money. Ethics are always ignored completely.
Most of the times people are on pressure. Your boss wants sales. What will you do if you don't do that?
It is understandable, but let me tell you, you see, if I was a patient, I come to your facility, I explain to you my problem, you tell me this problem you're having. Maybe I have the medicine that can help you, but I'm not going to give you this medicine until you ascertain this and this and this. So when I go to the hospital, they carry out all the necessary requirements as you've advised. I'm going to remember you for life because I'll know there is someone who is competent at a given facility. So even when I have a minor issue, I always have my trust in you. I'll come back. So sometimes we shouldn't look at getting the money out of the client, but you should also look at the long run. Have I built a trust between me and the client? Because it's something very crucial. But sometimes we just...
That is so helpful.
You see, money...
You might even end up losing your job. What if someone comes and they are from NDA, they want to see what you're going to do? Are you going to just give them the drug because they have money, or you know that you need a prescription such that you can give
and then
drug?
Before you know, tomorrow they are coming for you.
Hey,
You lose your job.
at that very moment, you give the guy a drug that is not supposed to be given to them, they just take you from your counter to jail.
And funny enough, if it is NDA, it is not about losing the job alone. Your papers are gone.
And these are common things. I think recently, just chipping this, you saw this news that was circulating around where a man was put under ARVs since 2018.
Yeah, I
Since
heard about
2018
that.
up to now, actually. Then he got to know that he
That's
actually
so
doesn't
sad.
have HIV.
In fact, the court ordered Tasso to compensate. The guy is going to become
They're
rich.
going to give him something, 100 and something.
Yeah, he's going to become rich. Source of wealth,
No, how did
wrong
that
prescription.
start?
You know, that goes back to medics. I think they made a misdiagnosis.
Now, sometimes it is something that can happen. You go to a laboratory to be tested. Now they are testing, like, let's say 4 people at the same time. So whenever they pick these samples, they are supposed to label them. Someone may mislabel the samples. And then after labeling the samples, they put your name on someone else's blood sample. And then this one goes on to another person's blood
But
sample.
then there is a certain hospital where I saw, even if they do such a mistake from the start, when you come back for the second dose, those people, they first know your viral load after taking all the other drugs. Now for that one who didn't even have
It's
the
tricky.
virus,
Now you see,
where did it come from? Or they could just pick the medicine without knowing your viral load.
sometimes we tend to rush things. We rush decisions. You see, even in a treatment regimens, there is something called first line treatment, second line, and then. By the way, it is also one of the causes of drug resistance. You see someone has a malaria, and we know that the first drug of choice to give to someone who has malaria is supposed to be antimicrobial, commonly known as Coartem. To come and tell you, Musao, for me, olaba kota moya mpunyira bubi. So because of that, you tend to switch from the first line onto the second line. Now you give Pialaxine, the dehydrogenase piperaquine. Now you're giving someone a drug which is supposed to come in as, after this one failing to work, it's supposed to come as a second line. So if you give that drug to this person, what do you expect? Next time, whenever they have a condition of the same kind, you give Coartem, it will not work. Definitely it will not work. So usually, because of recklessness,
It's all of us. All of us are involved in causing
we
this.
contribute a lot.
So we are supposed to also get involved in solving this issue, because we are all involved.
So for me, I think that since you do not have enough information about a certain thing, now you don't have any medical knowledge, I think you should you should lean on these medical personnel that already read their books, they know what they are doing, so you should always consult them before doing anything. Because for you don't know anything about them. If you just enter into a pharmacy to buy, of course, someone there will just give you the drug and you take it home.
Because I also assume you know what you want.
Yes.
Imagine someone coming from nowhere and then they tell you, Musao, please give me arachidonic acid. How do you expect someone who is not medically knowledgeable to know about arachidonic acid?
Which means you're already confident that they know what they want.
So I'll just give, you take your drug and...
Yeah, that's true. What should people actually keep in their minds, before we end the session?
It is very important for our dear viewers to know that this is health, this is life. So if you play with your life, definitely we've seen one of the consequences is what? Death. So it takes nothing from you to go and visit a healthcare service provider in case you have any problem. Even when it is just mere headache, it takes nothing from you, because these facilities are too many.
We should
almost
have family
everywhere.
doctors.
Even if you don't have a family doctor, it's okay, but the facilities are too many. And you see, the funny bit of it is that now look at the pharmacy. You're not going to pay consultation fee. You can go and disturb that person, disturb him, then you disappear, even when you're not going to buy anything, because it is your health. Just work on your health. Let us eat well. Let us always prioritize taking medical advice from qualified medical personnel. It is the most important thing.
Let us keep up spreading the gospel. I know some people know some of these things, but I don't want to share the message. But let us preach the gospel of drug resistance. We have talked about the causes, we have talked about the consequences, we have talked about the solutions. Always remember, your health is your wealth. Thank you for tuning in.
So thank you guys. Thank you for being part of today. And those who haven't subscribed, please it is of importance that you get this information whenever it drops. Go to our YouTube, subscribe to our channel, go to TikTok, like, comment, and share these videos to your family members, to your friends, such that they can get the information at hand. So thank you for following us. We've come to the end. Bye-bye.
Bye-bye.